Hello, this is Marian Pedraza from the University of Arizona Global Campus. This presentation is to review the Contra Costa Health Substance Use Treatment Program focusing on opioid addiction. Contra Costa Health, or CCH, is the integrated public health organization that services Northern California's Contra Costa County residents. CCH offers primary and treatment healthcare services. The substance use treatment program goal is to reduce the significant level of opioid-related deaths in the county with a focus on treatment, education, and community outreach. The target audience for the program are individuals who are at high risk for substance abuse behaviors, which include low income, poverty, low education, and high crime neighborhoods. In Contra Costa County, the leading cause of deaths for adults 25 to 54 years of age is drug-related. The program is not limited to patients and offers support services to family members, caregivers, and community members. These support services include substance abuse education, treatment plans, and medication distribution, which are important for providing comprehensive community support. The program's core service delivery is a comprehensive, evidence-based continuum of care designed to address the multifaceted public health challenge of substance use disorders. Primary service includes outpatient and intensive inpatient programs, which allow for clinical intervention while residents maintain community ties. CCH provides access to treatment and withdrawal management. A critical component of the managed care model is medication assisted treatment. Integrating FDA approved medications with behavioral therapies aim to reduce opioid related mortality within the county. The program emphasizes social determinants of health and health equity. This includes recovery support services such as peer-to-peer coaching, vocational assistance, and transitional housing. Ultimately, the goal of these services is to provide inclusive levels of care, ensuring that every resident, regardless of their socioeconomic status, has access to long-term recovery and community reintegration. For public health programs such as CCH Substance Use Program, thorough evaluation questions will lead to evidence-based outcomes that support program implementation and strengthen community health and improve health equity. These assessments include questions of what, how, and who. These answer The answers are to ensure the program is aligned with goals, achieving the intended outcomes, identifies areas for improvement, is sustainable and financially secure. This is done with assessments of service delivery and service quality, and review of data for informed decision making. The responsible parties are the program staff, internal and external stakeholders. Internal stakeholders are key individuals within the program who have an active influence on the program and have direct responsibility for decision making that will impact the program's effectiveness, such as the program staff and support services. External service External stakeholders are individuals or organizations outside the program who are affected by or can influence the program. The external stakeholders for CCH Substance Use Treatment Program consist of the target community with lived experience, funding organization, and local partners. It is vital that the program actively engages this audience to foster active participation, funding support, and ensure the community voice is heard. The ESW are stakeholders that have direct interest in the program findings and outcomes. They are expected to be actively engaged throughout the evaluation process. Having this working group ensures that multiple perspectives, from community members with lived experiences to local partnerships, are incorporated in the evaluation process. This is an overview of the logic model, which is a visual outline of how the program is expected to achieve goals. This is a high-level framework for evaluating effectiveness and continuous improvement efforts. The model begins with the inputs, which include program infrastructure and needs for operation that support the activities for prevention and treatment. The activities are the program actions, which are implementation tasks. The outputs are data collected from the implementation program, which are key indicators for the evaluation. The outputs lead to short-term, intermediate, and long-term outcomes. These are the effects after participation, from the immediate effect to some time of participation to long-term. This reflects the overall goal of the program. In this logic model, as it relates to Contra Costa Health substance use program, begins with the inputs, which are the resources for program operations, such as funding, staff, partnerships, facilities, medication, and educational material. The activities are actions such as outreach, managed care, and treatment services, referrals for recovery. These activities lead to outputs that measure the implementation, such as the number of outreach events, the number of individuals participating, increased quality of care, and increased access for healthcare services. The long-term effects range from increased knowledge to increased service access. The intermediate effects after some time of implementation include areas from increased engagement, reduced opioid emergencies, increased number of patients with long-term recovery, and policy reform. The long-term outcomes outlined here are increased health equity, decreased health disparities, and overall reduced substance abuse and opioid overdose rates, leading to overall community health improvements. Data collection will be done using existing data sources such as health records, health service logs, outreach events, surveys, and utilizing valid instruments of measure. This will increase outreach communication and improve engagement, which can mitigate barriers to low data concerns, low attainment, and limited resources. The evaluation method grid is a structured, easy-to-use tool from the CDC that aids program design and effectiveness assessments. The grid contains evaluation questions and activities that ensure the outputs generate meaningful data that support conclusions and are aligned with the program goals. The evaluation question leads to answers of what to measure, how to measure, where does the data come from, how often the data is collected, and who is responsible. This helps focus the evaluation, evaluate outreach effectiveness, lead to patient health improvements, increase engagement and retention in recovery, and have increased prevention impact on new substance use cases. The findings indicate that long-term recovery retention is positively influenced by culturally responsive communication. The program is effective with reducing new cases. Participants in the program describe improved overall physical and behavioral health. The program demonstrates strong collaboration with stakeholders by leveraging these partnerships with internal and external stakeholders. The communication plan and the strategy is to organize information using a structured tool for organizing evaluation findings for specified target audiences. Tools by the CDC identifies key stakeholders, the information needed, and the ideal format for each target audience. These tools explain how results will be shared to ensure they are used effectively and reach the desired target audience. The communication plan is a strategic foundation for how information is shared about the program's activities, evaluation progress, and outcomes. For CCH, Substance Use Treatment Program, the key information includes opioid treatment updates, outreach activities, and reduction rates in overdose rates. Essentially, communication plan ensures that information about the substance use treatment program supports public health by partnering with stakeholders and ensures timely decision making to ensure that the program is successful with its intended goals of reducing opioid and other substance use in the community. The communication tracket chart focuses on communication Execution. It details when to disseminate the information, who is responsible, the target audience, and what the communication modalities are to use. For the CCH Substance Use Program, some examples are stakeholder updates on program treatment access, community briefings on prevention workshops, information on medication access, and internal reviews on activity metrics. The tracking chart also identifies gaps or delays for activity adjustment and is a documented source of communication activities for accountability and evaluation. The communication plan and the tracking chart are complementary tools that ensure the CCH substance use treatment program communicates vital information clearly, effectively, consistently, and strengthens relationships with stakeholders to support the program's mission to reduce opioid-related harm in the community. A critique of the program, the evaluation findings indicate that the Contra Costa Health Substance Use Treatment Program is effective for the prevention, treatment, and long-term recovery of patients through a comprehensive, integrated, community-based approach. The strength of the program is demonstrated in robust stakeholder partnerships, outreach activities, and improvements in patient overall health. Identified opportunities for improvement are expanded outreach to vulnerable communities, enhancing prevention activities, and improving long-term retention strategies. Increased investment in culturally responsive services and data collection will be significant to advance the program's effectiveness. Overall, the program was effective in attaining its goals for reducing opioid-related mortality and increased health access. Thank you for your time.